So my mom passed away in December of last year. She succumbed to restrictive lung disease after a long, long battle with lots of different physical ailments, including a dropped foot. And she at one point in time had to have a cage put into her neck because it was affecting like the whole left part of her body. And because of that, she would fall quite often. So we had this woman who really, really wanted to live and would definitely want to do stuff herself, would definitely not want to have somebody else do it if she could do it. Definitely didn't want to wait for other people to do it. And so the combination of those things meant that she often would fall. And we would go through this horrendous amount of, running to the ER because since she was on Eliquis, she had to make sure that she didn't have a brain bleed. And we would be in the hospital. And sometimes, locally, we would be sitting in the hallway. We wouldn't even have a room. And so one time she was taken there by ambulance, and they literally took her off the ambulance and put her in the waiting room with us. But for a long time, that was kind of our life. My brother and I and all the grandkids and our spouses just responding to whatever happened. And there was just a lot of falls. And all the time that meant sitting for hours in an ER for her to go back home and then having to try to support her because she was so upset about it happening. And part of it was that she just didn't want it to happen. Part of it was that she kept doing those things even though we told her she couldn't, because that's just not the reality that she wanted. And it was really hard on all of us. Of course, it was really hard on her. And we kept living like that. And I remember one time I was, about a year before she passed away, I was out of town for my job. And she ended up falling 3 times in that week that I was away. And I just remember thinking, gosh, there has to be something better than this. We can't keep doing this. And please know, my brother and I were very much like advocates for her. We took her back to the doctor that did her back, the doctor that did her foot, the doctor that did her restrictive lung disease, which, by the way, at that point in time, we didn't know it was restrictive lung disease. They were treating her for COPD. And at some point in time, I just thought it was just so upsetting. There had to be a better way. And I remember running into really a high school friend of mine who was a palliative care, worked at palliative care. She was a certified registered nurse practitioner. And, she was somebody that my mom knew quite well. And I was able to get a referral for palliative care to start for my mom. And immediately Jody was our certified registered nurse practitioner, Jody Hewling, who I can't thank enough for her really making my mom have the best last 6 months that she could have. So what happened was, Jody came and she talked to Mom a lot. She would sit on the floor in front of Mom and talk to Mom about what Mom wanted and what type of living was good living. And one of the things she did almost immediately was really ask, did we really want the Eliquis? See, Eliquis is a blood thinner. My mom was on it because she had AFib. But my mom's AFib really wasn't a big deal. Like, out of all the things we dealt with, the heart doctor was not a place that we ended up having to go to. And so Jody was just questioning, does it make sense? Given not that the Eliquis was wrong for the AFib, but if we looked at my mom's situation in totality, did it make sense to do that right now? And the answer to that question was absolutely not. Absolutely not, because that was what was making every time she fell, us having to go call the ambulance, go to the emergency room, sit there for forever, sometimes get admitted, then have to go to therapy. It kind of set off this kind of horrendous period of time. And so Jody talked to the doctor then, and we mutually made the decision that we would take my mom off of Eliquis. And so the next time she fell, if she was okay, she didn't have to go to the ER. And that was really helpful. Jody also kind of thought about, well, why is my mom falling? And by then we knew that my mom had restrictive lung disease. And so Jody was very aware of the fact that my mom was having trouble breathing. And see, I thought my mom was falling because of the dropped foot. But what Jody told me and explained to me was that the drop foot wasn't helpful.
Right.
not helpful. But what Jody explained to me was that because my mom couldn't breathe, that when she used her walker, she kind of like hunched over. And that combined with the drop foot really gave this kind of horrendous storm that caused Mom to fall. And so Jody was able to put my mom on some medicine, some painkillers, that allowed my mom to relax enough, just a little bit, so that when she walked more upright. And so it helped her with her breathing, not to labor so much in her breathing. And the issue with it is that my mom didn't even know she was laboring in her breathing. Her restrictive lung disease had happened so gradually that kind of she wasn't aware of it. So it wasn't helpful when a doctor said, "Are you having trouble breathing?" Because Mom would say, "No." And even my brother and I had kind of gotten used to it. And the grandkids, that's just, how Nan was. And so Jody did that medicine for her. And that was amazing. My mom, Jody started around May, maybe a little earlier, but March was the 3 falls for sure. And around May, we kind of got all of this organized. It took me a while to get the referral, get Jody in there. I got all this organized. My mom never went to the ER after that. She never fell. And I think to myself, gosh, those years that could have been so better if I had just made the referral earlier. The other thing, and Court, you'll appreciate this, the other thing Jody shared with me was just, how hard it was for my mom to breathe and how many calories she needed. And that kind of explained why, even though I would buy all these peanuts on Amazon.
Oh my God, her grocery list. I feel like we do just have to talk about that for a minute. You would buy this woman, it was like she was eating as a 5-year-old. She's getting grapes, pretzels, and an entire block of Cabot cheese. And you're just a little woman. What's happening?
Don't forget the peanuts.
Oh, yes.
Yes.
And the Hershey chocolate bars with the almonds.
Yeah, absolutely. Absolutely. Yeah. So, Mom would eat and Mom was losing weight. And I thought, and don't forget the ice cream at night.
Well, and so she lived at a personal care home, and the little high school kids, I have cousins who are about that age, and they've always really liked Nan's, even though it's a different side of the family. So, they're giving her, instead of 1 ice cream, all of a sudden you open her freezer and she has 3 or 4 chocolate ice creams at the end of the night.
And I'd go over and I could see in her trash can beside her place, there's 2 little containers. Now they're just little, but it's still. But anyways, Jody explained to me that Mom really was losing weight because even though she was eating all of that, she really, it was taking so many calories for her body to breathe. And so that was helpful to me because it kind of changed my idea. And please know, I never thought Mom should stop eating. I never suggested that she do other things. But rather what I would do is I would be very conscious of that, and I would actually encourage it or offer it. If I saw 2 little containers and, I may have before that thought, well, she's had enough. And now I may say, hey, Mom, you want one? Or even if I myself was trying to watch what I was eating, I'd make sure I'd save my snacks for when I was with Mom, because sometimes she wouldn't eat unless I did. But, what I wanted to share was just, how important palliative care was to us. And at the end of Mom's life, she made the transition from palliative care to hospice. And hospice care, couldn't have been better for us, the whole experience. So I'm Julie Steinbacher, and I'm an elder care attorney. And I am here today with my daughter, Cortney, who we've put together this podcast called Hey Woman.
Yeah, and so we really want to kind of take a step back from, you and I work in an elder law firm, so you on the attorney side and me a little bit more in the back office. But really talking about, we considered ourselves two people that knew what the freak we were doing.
Yeah, we did. I did, yeah.
Right? Like you've dedicated 20 years of your life to this. It was so...
I appreciate the 20 years. It's been a little bit longer, but I appreciate 20 years.
Well, I don't know that we have to get too deep into math. I am a CPA, but sometimes you can round, right?
Right.
But I think what's important is that it was still really hard, and there were still things that we were learning how to do. It's different to see it on the outside looking in, and I think that that's what the palliative care gave us, was that it was somebody that was on the outside looking in and could just see it from a different perspective, because when you're in it day in and day out, it's hard to see the gradual changes. And so, Nan was such an important part of my life, and I've missed the phone calls. And so, really this podcast is a place for us to kind of replace that phone call that we would have made to her and talk about her. I think when I think about her falling, I don't even know, 75% of the time it's because she was leaning over her dryer because her nightgowns couldn't sit in the dryer for more than 30 seconds after the buzzer went off because they'd get wrinkled. Now, nobody's seeing her in said nightgown, but God forbid they be wrinkled, right? Yeah. So, and some of that you just weren't going to change in her. And nor would we have wanted to, but she wasn't going to wait for us because doing her laundry once a week was really not enough.
No, it absolutely was not enough for her. And, that was who she was. And so much of, caring for her in those last years was about me really changing my perspective into not fighting her, but really honoring who she was as a person and honoring what was important to her. So getting a shower in the morning, doing her laundry, all very, very important to her. So as a elder care attorney, I knew palliative care existed. I knew hospice care existed. I've certainly made referrals to both things. But I would say today, I would push so much harder because I don't even think I realized how absolutely helpful they could be. And we think about palliative care, maybe not for restrictive lung disease, maybe not for, her falling. But what palliative care is, for everybody to know, is palliative care and hospice care are really both benefits under Medicare. So anybody who gets Medicare can access palliative or hospice care as long as they're eligible. And both benefits would take a referral from a physician. And what the idea of it is, at least kind of from my perspective, is Jody, her certified registered nurse practitioner, in conjunction with the doctors, both at hospice and palliative care, and my mom's primary care doctor, was really to kind of look at exactly where she is today and what's important today with her symptoms and what she was dealing with. See, a lot of times, from my perspective, a doctor has a hat on of, how am I going to heal you? How am I going to get rid of this? Or how am I going to get rid of a symptom? But not to look at what is your life like and how can we give you a better quality of life? And palliative care is available to many people who are not utilizing it. Many, many people. If you're out there listening and you're caring for somebody, I'd encourage you to talk to the primary care physician about it. But please know, even at my law office, sometimes we make referrals to palliative care, and sometimes they say, oh no, this isn't covered. It's not covered under palliative care. But what I would say to you is looking at the law and looking at, the criteria, there's not a bright line test, So if you're dealing with significant symptoms that affect somebody's life, I'd encourage you to talk to the doctor about it. I'd also encourage you to talk to a palliative care provider, because sometimes you can get kind of shut off, if you will, because that doctor doesn't think they're necessary. See, remember, when we get something like palliative care and hospice involved, then your primary care doctor, some may feel like they're not necessary, they're not needed. And please know, I say that, as an elder care attorney who was very, very involved in my local area, with a phenomenal doctor who was trying to get hospice and palliative care more utilized by physicians. And some physicians didn't think that was what was in the best interest of their patients. And so sometimes that primary care physician can be like the hurdle you need to get over. And so I encourage you to reach out to palliative care, because my first call was to palliative care and was to a provider who said, oh, absolutely, we see people like that all the time. And then I went back to the doctor and said, hey, could I have a referral for this? And what happened was, Jody would come every 2 weeks, more often if necessary. She would also respond if my mom was not doing well. So with restrictive lung disease, I talked about the falls getting us to the hospital. But the other way we can get to the hospital is because mom had some exacerbation of what originally we thought was COPD, but was really restrictive lung disease. And she wasn't able to breathe. And so sometimes mom would, have allergies, or she could very easily get pneumonia. Mm-hmm. And so prior to having palliative care, mom wouldn't be doing as well. And then, our system is such that, mom's not doing as well. She really doesn't feel good. Now I have to call the doctor. Then I have to take her to the doctor's office. I have to get her in the car, take off work, get her there. And then the doctor's going to ask for an x-ray. Then we have to kind of wait and see. And please know, I appreciate her primary care physician. I can't, she did such a great job with mom and was always available. But it was a lot for mom. And often we were waiting until mom was really bad, either because mom didn't want to go through that process. And she knew it could lead to the hospital, and she didn't want to go to the hospital. So in those circumstances, now we would just call Jody, and Jody would come in, and Jody would listen to her, and Jody would then talk to the doctor, and then they could come up with a plan. And maybe we just went right and got the x-ray, so we were a step closer. And again, maybe we could immediately start some medicine to kind of squash that exacerbation rather than waiting for the results, having those trained eyes, being able to see her, talk it through with a doctor. Maybe we also, there was medicines that she was on, such as prednisone, that we'd kind of wait until mom got bad, and then we'd hit her with a whole bunch of prednisone. I mean, my mom had been on prednisone for years. And I remember even when you kids were little, I would be like, you can't drive with my kids on prednisone.
Did kind of throw her for a loop there.
Did make her a little bit erratic. But rather than doing that, just starting on a low dose of prednisone to kind of keep it at bay and not have mom have those ups and downs. And so I think that we don't utilize these services enough. And I wanted to take, time in this podcast to talk about it, because if people are out there caregiving and they don't know they exist, or they don't know, quite honestly, I'm telling you, you may have to advocate for them, And then the other, issue we had was hospice care.
And I think sometimes, when you made the call to me to say they were putting Nan on palliative and hospice care, I think that's an emotional thing for the caregiver, because I feel like more people know what hospice care is, right? That's the end of life care. And so there's an acknowledgement of that this could be the end. But Nan was on hospice for, 6-7 months. It can be the end for a while. It doesn't mean it's immediate. People also can graduate from hospice and they can go back to living a normal life. And so it's about leading the quality of life and making sure that quality of life is what she wants, and that was so much clearer once we were able to get a palliative care doctor in. I also think we talk about taking Nan to the hospital, and we talk about taking her to the doctor. I think it's important for us to talk about, too. We lived in a really rural area.
Yeah.
And so, those doctors and the hospitals, they're doing the best that they can. We kind of have one option. And so that can create backlogs, and that also creates a little bit more of a an extra environment that you're trying to get into with these doctors and the x-rays. There just aren't as many appointments because you kind of have one option. And so it also was a big deal, you know, to Nan, not so much anymore. I mean, the hospital was 15 minutes, 20 minutes from our house, but to Nan, she had to go over the mountain. And I remember, like, she would talk to me about that. And so, you know, we lived in this valley and you went over the mountain into town. That was a big deal to her. And so that's also part of like being true to who we are. Like for you, you went over the mountain every day to work. It wasn't really that big of a deal. But for Nan, it's like, oh my gosh, like we have to do this. Like I remember being a little kid and she ran all of her errands at one time. Mm-hmm. And you couldn't forget something on the grocery list because she couldn't go over the mountain again. And it's like, well, you can, like the mountain doesn't close over the weekend. But for her, that was also like this mental block. So I think there's, you know, on the caregivers, you're thinking about, you know, the mental block of thinking about palliative and health and hospice care and like this is the end. But it really helps kind of unlock for the person that you're caregiving what you want their last, you know, months, years to look like, and that they were so much less stressful for us because we were able to stay true to what Nan wanted.
Yeah, and we also were able to talk to somebody who would take time to explain to us and to have the tough conversations with Mom about really what was happening, what was going on, and what could we expect. And Jody couldn't tell us, and the doctors couldn't tell us. Of course, they can't tell us, you know, exact things, but they could talk to us that based on their experience, you know, based on this disease process, this is what we can expect. And what's ahead, which is always really important to know. And it's important to know for Mom, too. And it's important to, you know, I've had those conversations with many, many families. I started as a social worker in a nursing home. It's harder to look at your own mom and have those conversations. So having somebody else that was kind of willing to, you know, lead that conversation. I think also for me, I think there was times that I thought my mom would just agree with what I wanted, which is kind of funny because earlier in life that would not have been that dynamic. But I thought it was also a gift that she got to talk to Jody about those things and really tell Jody what she was feeling and maybe even admit some of her own vulnerabilities and being scared that she may not have wanted to admit to me because she didn't want to put something else on my shoulders. Like somehow if she remained strong, it would be easier for me. It's not really true, but I could see that her being that way. And I think that, you know, once we went through the palliative care, you know, at some point in time we did switch to hospice. And unfortunately, Mom had another thing on top of, so she had a problem with her sciatica nerve. And given her limited mobility, given her restrictive lung disease, kind of doing the therapy through that wasn't really an option. And so we had to increase pain medicine. And we had to, and when we did that, we enrolled in hospice. And when we enrolled, quite honestly, I think it still could have went either way. Mm-hmm. That we may have been able to get her through that. But we needed the other medicine, and then there are rules and regulations about administering pain medicine, and what that did was it allowed us to get that more pain medicine, and because there was different guidelines, and also get more care. So even though we were very, very involved, she lived in a personal care home. We were there. I slept with her most nights. But even though we were still involved, like my mom's laying in a bed and I don't actually know the proper technique of how to bathe her, you know,
right.
in the bed. I mean, they don't teach that in law school. I mean,
right.
I didn't know. And I was like, wow, these, you know, people have some tricks of the trade, you know.
Oh my gosh. Do you remember when it wasn't a hospice nurse, but the nurse at the village where she lived in Fenosa Valley Village that was able to get the mattress,
yes,
like the air mattress. So, you know, Nan was in the bed and this guy comes, hospice had ordered this bed, and he's standing there with this air mattress looking at me, and he was like, you have to get her out of the bed. And I was like, she doesn't we can't actually get her out of the bed.
Yeah.
Like, you know.
Not possible right now.
I was like, she's been in the bed for a day. Like, we can't get her out of the bed. He's looking at me and he's just holding this air mattress. And then this nurse comes in.
Oh, he put the air mattress down and laughed.
Yeah, he did. He ran right out of there. He was like, he's like, you have to sign for it. And I was like, well, we can't use it, but okay, like, I'll sign for it. And then the nurse came in and she's like, well, I can get the mattress on. And they did. And I'm sure Nan was not thrilled about the technique that was used. We want to talk about, tricks of the trade. They just like slid that right on there and shoved it right up the hospital bed. Like and it made such a difference in her. And she was able to, be in the bed, and it was able to move like her weight around so that she was able to get more comfortable. Like, it needed to be done. But yeah, they don't teach you that. Definitely not when I got my master's in accounting. They weren't like, and by the way, this is how you, thread an air mattress under somebody or something.
Yeah, that was Lisa there, who just was so great with the solutions that we needed when we confronted something that we didn't know how to do. Yeah, so hospice came in, and hospice, at that time, talking about things was a little bit more for us than it was necessarily for her, and just helping us be able to be there. But it came with all kinds, and that's the thing, like, so part of this we're talking about, this whole podcast, Hey Woman, is what we called my mom, Courtney's Nana. Hey Woman, how are you? And so part of this is really making sure she got the care she needed, and then we got the support that we needed. But the other thing I want everybody who's listening to know, and here's I'll put my attorney hat on, my elder care attorney hat on, is hospice is a really good financial benefit. It's paid through by Medicare. So all that air mattress that they slid through, paid for by Medicare. If mom needed a hospital bed, if mom needed, equipment, all of a sudden, we got hospice, and all this stuff started coming, the Depends, the creams that we needed, everything just was now, rather than us paying for them, was now paid under this benefit through hospice. And so I remember, gosh, Court, you were just a little kid. I remember when my Aunt Ev was very sick with congestive heart failure, and she was actually on hospice for 4 years. Aunt Ev is she was a powerful woman who decided that she wanted to stay living, and so she actually was on hospice for 4 years. But during that time, part of the real value for her is that, and please know, her congestive heart failure was no doctor could have known that she would have lived. I remember one time visiting her, and the doctor looked at me and said, actually, Courtney, I was holding Aunt Ev's hand, and the doctor came to me and said, I have no idea why this woman is still alive. But the important thing that I'm trying to get to is that it's also a good financial benefit. Mm-hmm. And for some families, that's really helpful because they're struggling. They couldn't really pay for somebody to come in and give that bath, or they're struggling to get the Depends and all of the stuff, because that stuff's really, really expensive. And so, caregiving is hard, but there is a huge financial burden there too. And I think that's important in these political and economic times, because we don't know what's going to happen with some of the funding for some programs. We don't know what's going to happen for those fundings for medical assistance. We don't know what's going to happen. Some programs have been cut. But so far, Medicare seems not, like these types of benefits that we're talking about, seem not to be kind of on the chopping block, if you will. And so I think that it's important people know that they're out there. And it's, there's a lot of different benefits, and it matters if you have a Medicare Advantage or what type of Medicare. I would say with these, it really doesn't matter. They're like, foundational is not the proper word, but maybe like the core offerings of what people get through Medicare. For those of you who don't know, Medicare is a program that people get through, paying into the Social Security Administration. So most everybody who's older, over 65, will get some form of Medicare. And there's, basic Medicare, Part A, there's Part B, there's Part C and D, and for some people they have an Advantage program that covers all of that. But important for us to understand that this benefit, also is helpful to us. Because we were already expending a lot of money on her care. We were already paying for caregivers, during the day sometimes, even though, family members were there at night. And so I think it's important for people to know, and I urge you to look into it kind of no matter what the diagnosis is. And, I hate to tell people to Google, but I would say that the Medicare.gov website would be a good source of information for things like this. And you can look up, your own diagnosis and kind of, arm yourself with some information to better understand if maybe your person that you're caregiving for meets that definition. Now, please know, I want to give all deference to the physicians that are involved, because they're the ones that can take that diagnosis and where we're at and really decide, does this make sense in this circumstance? And I'm sure any physician or attorney or CPA or any professional that's listening, and I just told people to Google things, right? But I do think the Medicare.gov site is a helpful site and has good information in it.
A little bit more helpful than your WebMD search after you get your, blood test back or whatever that we all do, and we decide that we have, that rare disease. Medicare.
Yeah, because you have 3 out of 5 symptoms.
Right. That maybe not. Right. We haven't talked to a doctor, but WebMD says. No, I do think the Medicare.gov site is helpful. Mm-hmm. I also think what's really important is, what palliative care was able to give to Nan sometimes was what medicine couldn't. Yes. Which was, so the physicians are phenomenal, and they're really great with the medicines and the diagnoses and all of that stuff. But, we've touched on it a couple of times, and it's because it was so important to Nan. Getting her shower was important.
Yes.
And so, the facility that she lived in, like a lot of facilities, they have a shower schedule. Well, Nan wasn't really going to be beholden to somebody else's shower schedule.
You silly goose. No.
Even when they, taped it up in her room semi-passive-aggressively so that she could see what her schedule was. And sometimes even when it was her day, they would come and she wasn't quite ready yet. Mm-hmm. she hadn't drank her coffee. This was not her schedule. Or
she had already taken her shower by herself. Because she wasn't waiting for them.
Right, because she had things to do that day. Yeah. Like she had to get to bingo.
Yeah.
And so, it's a process. You have to take the shower, and then you have to do your hair, and you have to do your makeup. And so, because you can't walk out to bingo without your makeup being done.
The one time I just, sometimes I didn't know if I should scream at her, hug her, respect her. I don't know. But, I will never forget one time I used to go over. This is before we got the caregivers. This was actually probably the reason I went and said, oh, my goodness, I have to do this. So I would go over before I'd go to work. So she lived right across the street from me. So I'd go over with my coffee, and she really did enjoy her coffee. And so I would often stop by. And I'm there one day, and I stopped by a little bit later than usual, so she must have thought I was already on my way to work. She would never have done this if she thought I was going to find out. She's in the shower. Her walker is outside the shower. Now, she has the call bell draped over the walker because she knows she could fall. It's not like she didn't know. This is not somebody that isn't aware that, this is probably not something I should be doing. So she has the call bell draped over the walker. And, she's in there, and I walk in, and I'm like, woman, what are you doing?
Well, once she's in the shower, they have to help her get out.
I know.
It was like,
oh, no, she was going to get out by herself. That call bell was just in case she fell, so she could pull the call bell. But yeah, you're right. What were they going to do? And I said, what are you doing? And she said, well, they didn't come. And I forget, I think she had to go to an exercise class or something that day. I was like, Mom, she's like, well, I needed a shower. So it didn't matter how much I told her that she could hurt herself. In her mind, getting ready was more important. Why not? She's not going to just sit there,
Well, God forbid you go to your exercise class and get sweaty and you haven't showered beforehand. Like, in deference to the nurses at the village, they could have thought that, well, she'll shower after.
I know that, and that's a good thought, right?
I mean, I don't shower before I go to the gym, but she did.
Yeah, but you're talking about a woman who, when I grew up, wouldn't even go to the local, and you already talked about the fact that it's so rural, so this is just like a little country store. She wouldn't go there in jeans. She had to dress up before she did that, And so, and I think that's important for all of us who are caregiving. Don't fight this stuff. That's who they are. That's who she was. So even, when you talked about earlier about going to the doctor, part of what made it so hard to go to the doctor is that we had to get a shower. We had to get our clothes on, nice clothes. We had to do our makeup. Like, we weren't just going to the doctor. We were looking good going to the doctor.
When we had to run our errands after we went to the doctor, because you could only go over the mountain once.
Right.
And so, like, you could fight it and you could try to, and God knows you and I just, like, crammed her into our schedule. We're leaving work meetings. We're coming home, driving back down maybe a little faster than we should because, we're always running, like, 5 minutes late. And which is probably why she preferred when my brother DJ or when my dad did it, because they weren't late.
Yeah.
And afterwards, you could get mad at her that she wanted to go to Tony's, a local deli, to get her groceries. But that was just who she was, and that's the way she thought about it. I'm going to town once today, and when I go to town, I do my appointments, and I do all of my errands. And so I'm going to go to the dry cleaner. I haven't been out to dinner, or I can't tell you the last time I've dry cleaned anything, but she dry cleaned all kinds of stuff. Like, you just look at her like, woman, like, how do you have all this stuff to drop off at the dry cleaner? Mm-hmm. She did. Yeah. She had to go to Tony's, and whatever she couldn't get at Tony's, she had to pick up at Wegmans. And sometimes she tried to sneak in a giant run in there, and I would put my foot down. One grocery store is enough.
Well, they're on opposite ends of the city.
Right. So it wasn't the easiest thing to go to, but, like, whatever you can get at Wegmans, you can. You don't need to go to giant.
You talk about the driving, so, like, we're here in New York City together, taping this podcast, and DJ, my son, drove us into New York City, and that was maybe shouldn't have been anybody's intentional plan. It certainly wasn't his intentional plan.
He looked a little stressed when he came here.
The funny thing is that when you just talked about, like, DJ or Dad taking her to the doctor, like, they don't rush for anything.
No.
Like, and I have to say, I'm a little concerned about, like, hereditary and stuff, because, like, DJ drove in the city exactly the way his father, my husband, would have driven. It was like, you can switch lanes. Or we can sit here in this lane for the next half hour while all the other cars are going by.
Well, and he'll be like, I have a CDL. And I'm like, I know, but we're in a Jeep, not an 18-wheeler. Like, you can merge.
Absolutely. But that's, one of the things that she appreciated about their driving was that they were so cautious and never, that she never felt rushed. And so one of the things I really want people who are listening to know is that they're not alone. I think this becomes so hard. And there's a lot of help that's out there. But, one of the things that I recently was working with the Alzheimer's Association with, which Alzheimer's Association is, Alzheimer's and any other form of dementia, but they have a lot of really good statistics. And in 2025, they just released them, and 76.6% of people who are caregivers have their own chronic health condition. About 50% of people, over 50% of people, are still working. And, the statistics are that 16% of those people will take a leave of absence. And so, we talk on here about my mom, your Nana, and we talk about the restrictive lung disease, and we talk about, that diagnosis. But there's certainly other diagnoses that go on for years and have kind of this same feeling that, really, to be honest with you, if you're the caregiver, you can feel alone. You cannot know where to turn to. And part of this podcast is just letting people know there's a place to turn to. And I urge hospice and palliative care, really understanding what you can get through Medicare. But I would also say that there's other things that people can do, very underutilized program that is really nationwide. It's administered slightly differently in every state, but is nationwide through the Office of Aging, is the Caregiver Support Program. And that's a program that provides some financial assistance to caregivers who are really trying to make ends meet and are in situations like I was. I'm picking up prescriptions, I'm picking up all kinds of things at, the Rite Aid or the CVS or, Walmart that mom needed. And, I'm not always getting reimbursed for them. And sometimes, quite honestly, I wasn't getting reimbursed because mom was kind of running out of money. And so I just, I think that I want people to know that you're not alone. And there are programs and helps out there, but you have to advocate. You have listening to, a podcast like this, to build a sense of community for yourself, and really questioning the doctors or the healthcare providers, or getting on, Googling your local palliative and hospice care provider and just having a conversation with them. I also think, across the nation, there's a lot of elder law or elder care attorneys like myself who have people on staff who can help with this. We at our office have navigators. We help people navigate these journeys. We are on a daily basis talking to people about, I think this person needs a referral to hospice and palliative care. Do you want us to help you with that? And so I think it's important for everybody. My hope is that you listen to this and you realize the journey can be a little better. You're not alone. We're here.
And if you're looking to find an elder law and estate planning attorney in your area, you can always go to the planningandprotecting.com website. There's lots of free resources. There's local resources. And we want to say thanks for listening and thanks for giving us a space for us to share what we learned in our journey as we went through it together. And we know that some people have that support and some don't. So we hope that you can find it here.